Dementia is one of the world's fastest growing diseases. In fact, more than 24 million people live with dementia every day. Unless you have a loved one affected by this devastating issue, you may think to yourself that this is someone else's issue or something old people deal with, right? Well, by the year 2040, it is expected that 84 million people will be affected by some form of dementia. That's our parents, our friends, and even ourselves that will be affected. Dementia is a huge problem, and today I'm going to tell you a little bit about the 3 most common forms of dementia, treatment options, and how to start preventing dementia in yourself and loved ones. The most common and well-known form of dementia is Alzheimer's disease. Alzheimer's disease accounts for 50 to 80% of all dementia cases. While some memory loss is a normal part of aging, Alzheimer's is not. However, the risk for Alzheimer's disease does increase as you age, and by the time a person is 80 years old, there's a 50% chance that they'll be affected. Symptoms of Alzheimer's disease include difficulty remembering recently learned information. This is usually the first noticed symptom. As the disease progresses, more symptoms such as disorientation, mood changes, depression, confusion about time and place occur. During the last stages of dementia, the symptoms are very severe and include unfounded suspicions about loved ones and caretakers, difficulty speaking, eating, and walking. Alzheimer's disease worsens as time goes on and can take many, many years to fully form. Right now, Alzheimer's disease is the 6th leading cause of death in the United States. As of right now, there is no cure for Alzheimer's, but there are a few treatment options that can help offset some of the symptoms. Medications such as cholesterol inhibitors and methamphetamine can help with the cognitive symptoms of Alzheimer's. But because brain cells die and connections are lost as Alzheimer's progresses, current medications cannot stop the decline of Alzheimer's, and they can only stabilize symptoms for short periods of time. So can Alzheimer's disease be prevented? A combination of factors such as age, genetics, environment, lifestyle, and pre-existing conditions contribute to one's overall risk for Alzheimer's. As drug trials continue, researchers are hoping that they can use genetic testing to screen for individuals with a higher risk of dementia. As of right now, though, genetic screening is not recommended because there is no cure. While there is no cure, researchers have established a connection between heart health and brain health, so keep your heart healthy. Other prevention techniques include a proper diet and exercise. As always, talk to your doctor if you have any concerns. Vascular dementia is the 2nd most common form of dementia. Vascular dementia causes a decline in thinking skills due to a reduced blood flow to the brain, which deprives it of oxygen and nutrients. If the brain continues to receive a lack of oxygen, the inadequate blood flow will eventually kill cells all over the body, but the brain is most affected. In cases of vascular dementia, dramatic changes in thinking skills can occur suddenly if the person is suffering from a stroke. After the person has suffered from a stroke, they are more at risk to suffer from multiple minor strokes, which can further brain damage. Vascular dementia can occur concurrently with Alzheimer's disease and dementia with Lewy bodies. Vascular dementia accounts for 20 to 30% of all dementia cases. Symptoms for vascular dementia can vary depending on blood vessel damage and the area of the brain that has been affected. Common symptoms include confusion, disorientation, trouble speaking or understanding speech, and vision loss. These symptoms often occur concurrently with traditional stroke symptoms, making it very hard to diagnose. Other symptoms include impaired planning and judgment, uncontrollable laughter and crying, an inability to pay attention, and a decline in social functioning. Like Alzheimer's disease, there is no cure for vascular dementia. Researchers do believe, however, that the drugs used to stabilize Alzheimer's may also do the same for vascular dementia. The best way to prevent this form of dementia is to avoid having a stroke. You can best do this by not smoking, eating a healthy diet, exercising, maintaining a healthy weight, and limiting your alcohol consumption. Dementia with Lewy bodies, or DLB, is the 3rd most common form of dementia. DLB is a progressive dementia that causes a decline in thinking, reasoning, and independent function because of abnormal microscopic deposits that damage the brain over time. DLB accounts for 10 to 25% of all dementia cases. The brain abnormalities linked in dementia with Lewy bodies are named after Frederick H. Lewy, a neurologist who discovered them while working with Louis Alzheimer, the man who discovered Alzheimer's disease in the early 20th century. Alpha-synuclein, the main component of Lewy bodies, is widely found in the brain but has no known normal function. Lewy bodies are also found in other brain disorders, such as Alzheimer's disease and Parkinson's. Symptoms of dementia with Lewy bodies include changes in thinking and reasoning, confusion, Parkinson-like symptoms such as a hunched posture, balance issues, and rigid muscles. They also experience hallucinations, delusions. They also violently act out dreams and have memory loss. Unfortunately, researchers have not yet identified any specific cause of dementia with Lewy bodies, and most people diagnosed with DLB have no family history of disease or genes that can be linked to it. Like most forms of dementia, there are no treatments that can cure or slow the brain cell damage caused by DLB. Most treatments focus on alleviating symptoms, and this is done with antipsychotic drugs and antidepressants. Now that you know about the 3 most common forms of dementia, I hope that you'll be interested to learn more about prevention and how to help those already suffering from this devastating disease. Remember, the best way to avoid developing dementia is to not smoke, eat a healthy diet, exercise, and talk to your doctor. Thank you for listening to my presentation. I hope you enjoyed it.